Welcome to Your Health. I'm your host, Rhonda Alford. Joining us on this episode is Dr. Leslie Ming, medical oncologist at Terrebonne General Mary Bird Perkins Cancer Center, and family medicine nurse practitioner Allison Bergeron from the Terrebonne General Multi-Specialty Clinic in Gray. They're going to be talking to us about ovarian cancer prevention, signs, and symptoms. Welcome to the show, Dr. Ming and Allison.
Thank you.
Well, let's get started with you telling us a little bit more about yourself and your roles. Dr. Ming, please go first.
Well, I am a medical hematologist oncologist that practices here, and we specialize in treating any type of patient with blood disorders or any type of cancer.
Okay, and Allison?
Yes, so I am a family nurse practitioner. I'm at our multi-specialty clinic in Gray, where we do internal medicine and family medicine and a lot of preventive health.
All right. Well, thank y'all so much for being here today. Dr. Ming, we're going to get started with you. Can you tell us more about ovarian cancer and how common it is among women?
Absolutely. So ovarian cancer is when abnormal cells start in the ovary, and then they grow uncontrollably, and they form a mass, and that mass can actually destroy healthy ovarian tissue. As far as commonality, it's the second most common cause of GYN malignancy in the United States. Usually about 1 in 78 women are at risk of developing ovarian cancer.
My goodness, I didn't realize it was so prevalent. So is there different stages of ovarian cancer, and at a certain age that it might be more prevalent?
Yes, so there are different stages. There are 4 stages, and ovarian cancer can actually occur at any age. It can even involve children, but the most common average age is around 63.
Okay. And Allison, what are the main risk factors involved for developing ovarian cancer?
So with ovarian cancer, just like other cancers, a lot of times they have a lot of the same risk factors. So, being overweight, smoking, but also family history, having a child at an older age if you're over 30 years old, and then other things like not taking oral contraceptives, so you ovulate more, things like that definitely can make you more at risk.
Okay, so that sounds like a lot of women
really is,
in that
yeah.
category. But how important is family history in assessing the risk for ovarian cancer? And should women with a family history take any type of precautions?
So family history is important, as with all things, because you can have certain genes that pass things down. With ovarian cancer, we worry about the BRCA1 and 2 gene, as well as Lynch syndrome, which is something that happens when people have colon, ovarian, uterine kind of cancers. You have a distinct family history, though, when you have that. And when we do have family history, there is certain things that we can do to make sure our patient is getting what they need to prevent things or catch it early.
And are there any signs and symptoms that women should be aware of?
So the thing with ovarian cancer is that signs and symptoms, when I tell you what they are, us women, we get it multiple times a month probably. When you have it more days than not is when we worry. Bloating is definitely one of them. Also, constipation can be a sign, going to the restroom, having to urinate more frequently. And then when you're eating, you get full faster than usual. And with any cancers, if you're losing weight without trying, that's always a sign and symptom.
Most people, if they're losing weight, they're like, oh, this is a good thing. But in this case, it's not a good thing. Dr. Ming, are there any particular symptoms that go unnoticed or can be mistaken?
Sure. So patients can present with indigestion. So a lot of times women think that they're having a GI issue because they can also present with nausea and vomiting. So no matter what, if any symptoms persist, they should just make sure they see their physician and talk to them about it, or their primary care practitioner.
And Allison, is there a routine screening or a test for ovarian cancer similar to mammograms for breast cancer?
So people of average risk, there isn't really a routine screening that we do other than go for your annual women's exams. Because when they do, not a pap smear, that's for cervical cancer, but there's other bimanual exams that they do to feel the ovaries. But if you have a family history, then you are at higher risk. And in that case, we can do certain things as a transvaginal ultrasound every other year. And some people say things about blood work and checking a CA 125, but that really isn't something that's recommended for screening because that can be elevated because of a lot of different things. So mainly transvaginal ultrasound is a good way to screen if you have a history, as well as the genetic blood test.
What is the typical treatment for ovarian cancer?
So it varies by stage, but usually there's a combination of chemotherapy and surgery. Nowadays, though, we're using targeted agents, so there's tests we can run in the blood and on the tissue itself called next-gen sequencing, so we can see if we can offer them therapy that would work quicker to kill their cancer. And then there's also immunotherapy, which is a way of using medications to boost your own immune system to kill the cancer faster.
Okay, so there are very viable treatments. All right, well, this is a very important subject. Is there anything that you really want our viewers to know out there that they should know about the signs and symptoms of prevention?
The biggest thing is, and I've had an ovarian cancer affect me personally. My mom had a rare form, and looking back at the signs now, I probably would have been more aware. But just spreading awareness, knowing that if you have something wrong, my mom had indigestion. She was eating and she'd get full quicker. She had nausea and vomiting, felt bloated. And it was more the days than not. And when you look back, you think, wow, maybe we could have caught this earlier, but ovarian cancer is not something you usually catch early.
Right.
It's difficult.
Well,
yeah.
hopefully we're helping spread awareness with this
Yes,
show.
that's why
Okay,
it's so
Dr.
important.
Ming, anything?
No, I think people just need to realize that, remember, if something is caught early, then the success rate with treatment is much better. So go for your screening tests.
Yes. Okay, well, thank you both for being here today and sharing this helpful information. For more information about ovarian cancer, visit tghealthsystem.com. Thanks so much for being with us today. I'm Rhonda Alfred, and we'll see you right back here next week.